behalf of the Integrated Health and Wellbeing Council, I welcome all of you to this Women's Day special panel discussion titled Empowering Women for Better Health, Navigating Vaccinations from Preconception to Postpartum. This panel discussion is an initiative of the IHW Council and Raksha, an initiative by FOGSI and supported by Zydus. So let me take this opportunity to introduce our array of experts today. I have with me Dr. Jaideep Tang, who's the President, FOGSI. I have Dr. Ritu Khanna, who's the Director at Khanna Medical Center and Fertility Clinic. I have Dr. Basap Mukherjee, who's a gynecologist, obstetrician, and reproductive endocrinologist. And I have Dr. Pala Naipan, obstetrician at SRMC Chennai and member of the Indian Medical Association. I also have with me Dr. Parikshit Tang, who's an MBBS MD, obstetrics and gynecology at Ashwani Maternity and Surgical Hospital. Welcome to the discussion, sir. And I am overwhelmed to have such an array of experts with me today. So thanks to all our experts for taking out time from their very busy schedule and joining us for this awareness session. So to set the stage, I would first come to Dr. Jaideep Tang. When we talk about the significance of women's health, sir, and why it needs to be prioritized, considering the key challenges that women face in accessing healthcare, especially in a country like ours, where there's a lot of stigma and taboo related. So could you please elaborate on why women's health is imperative?
Thank you very much, Dr. Bajaj. Thank you to Ritu, Zydus for putting this webinar together, and thank you for all the faculty from FOGSI for participating, Dr. Palaniappan, Dr. Basab, and Dr. Parikshit Tang. I'm Jaideep Tang. I'm the president of FOGSI. And I think it's, in a way, Dr. Bajaj, I think it's a little sad that we are even considering a question like this. After all, the fact that women's health should be a priority and the fact that women's health needs to be addressed should be self-evident. We had a very eminent obstetrician and gynecologist called Professor Mohammed Fatala, who was one of the very prominent workers in women's health. And he had this very famous quotation which said that women are not dying because of diseases that we cannot treat. They are dying because we still have to make the decision that their lives are worth saving. And I think it's such a striking observation. And I think the reason is threefold. The first is, of course, women constitute half and sometimes more than half of our population. If you don't prioritize the health of half of your population, then what in the world are you really doing? The second is that a lot of health issues which women face, which ultimately result in either morbidity or mortality, are preventable. Consider the fact that when a woman gets pregnant, she does not do so because she has, or any other gender can have a pregnancy. She gets pregnant because of the simple fact that she's born a woman. It's not as if males can have a pregnancy. And it's sad that for this biological fact, women have mortality and morbidity. Also consider the fact that in a large number of circumstances, deaths and morbidities which occur due to pregnancy are preventable. Now, there is a caveat to this to say that they aren't always preventable. But in a large number of instances, they are actually preventable. And lastly, women's health directly contributes to the potential of the country. Not only does it contribute to the potential of the country, it also contributes to women's mental well-being. A healthy woman is a happy woman, is a productive woman, and ultimately it's the nation which benefits. So I can pretty much go on and on about why it should be prioritized, but I think given the fact that women hold up, as they say, half the sky, the fact that in a lot of instances, the issues which women face are preventable, and lastly, the fact that nation building has to take into account women's health, I think are good enough reasons for us to prioritize women's.
Thank you, Dr. Jaideep Tang. That was indeed a very good overview where you have set the stage for further discussion. Coming to you, Dr. Ritu, when we talk about the significance of vaccinations for women's health, and what are some of the key vaccines that you would recommend for women at various stages of their life? Give us an insight on those.
Yeah. So thanks to our President FOGSI, Dr. Jaideep Tang, and Zydus for bringing us all together on this panel today. And taking women's very apt, we are discussing so much about vaccines, but why is it so important? The first would be that it's critical to women's health, just like a general population. More so, there's a concern because of the childbearing phases in her life. Now, it's going to prevent these women from the newborn and also the newborn from the life-threatening diseases. The maternal and neonatal mortality will decrease. It's going to improve the overall well-being, and thereby the health cost goes down. And immunization on the second point would be that it will reduce the spread of these infections. So the need and use of the antibiotics is going to go down, and therefore contributing to the battle against the antimicrobial resistance that we are facing here. Now, coming to the preconception vaccination is actually an ideal time for preventive healthcare strategy. It safeguards the maternal and the fetal well-being, and therefore we're going to have healthier pregnancies, ensuring a long-term health of the population. And the recommended vaccines for preconception are the HPV, the MMR, influenza, the varicella, and the hepatitis B. Moving on to the pregnancy, the infection in pregnancy increases the risk of serious complications, and thereby the pregnancy outcomes are going to be poor. So immunization during pregnancy is very simple. It's a unique strategy, and it's a very, very effective way to protect the mother and child, and that's by the transfer of antibodies from the mother to fetus. Now, if we go to the recommendations of vaccines in pregnancy are the TD, we have the influenza, and the Tdap. Now, as the immunity during the first few weeks of life is not expected to be fully protective, so this maternal immunity is the only effective strategy to cover the immunity gap of the first 6 weeks of life. Coming to the postpartum, that's a good time for all the catch-up vaccinations. So vaccination stands as one of the most cost-effective ways of saving lives and thereby promoting good health and well-being.
Dr. Ritu, very aptly you've pointed out about the major milestones when it comes to vaccination. Dr. Parikshit Tang, coming to you, what are specific preventive measures that are particularly crucial for women at different stages of their life? Give us an overview on that.
Okay, so that's really a very broad and overarching kind of a question. And when we talk about women's lives, I mean, typically we, talk about the reproductive age group, but actually it's much more. We know that. So, I mean, right from when this is a girl child, we need to think about it from that spectrum onwards. Just as any young child would be looked after, once we cross into the teens, today we are looking at an earlier initiation of immunizations, and that includes the HPV vaccine, which is now being brought into the national program in India. As the girl grows, becomes a young woman, we are looking at when we talk about preventive aspects, we are talking about a healthy reproductive life. So contraception in the early phase of sexual activity, preventing unwanted pregnancies. This is where the discussion should be on optimizing reproductive health, reducing the risk of sexually transmitted infections. As this young woman plans to have a family, then the entire spectrum of pregnancy-related care, antenatal care, and good health during the pregnancy and safe delivery This is what the focus is going to be. And as we come towards the 40s and towards the end of her reproductive years, we are looking at optimizing her health in the menopausal age group. And here I must emphasize the need for supplementations, including calcium, and of course, right through life, really. I mean, optimizing physical activity, uh, paying due respect to the type of diet, etc. All these are important functions that we should fulfill.
Right, Dr. Parikshit, thanks for that answer. Coming to you, Dr. Basam, when we talk about specific barriers or challenges that contribute to low vaccine uptake among certain groups of women, what would be your take on that?
Yeah, thank you, Dr. Bejat. I think it's very important that one of the barriers to a universal vaccination or everybody getting a vaccine is sometimes the barriers which come in between. The very fact that you want to do a plan, you want to plan it out, and it doesn't exactly get executed. So barriers can happen at the individual level, where the person himself or herself in different circumstances is hesitant to get the vaccine because of sometimes it's the fear of the unknown. Sometimes it's something which they have heard from other people that it may not be in your best interest or safe. Some wrong reports at some point of time which have affected their mental state of mind or their families, and that is something which is influencing their decision of not taking a vaccine, even knowing that it is available. So I think those are some of the problems or barriers at an individual level. A lot of healthcare in India is also driven by the family and by the people around them. So a lot of family decides on whether contraception is used when a woman has a child. And similarly, a lot of family decides on whether a vaccination is a good idea for the family or whether it is important for business to be pursued. So I think that again, awareness drives health education, breaking the myths, breaking the barriers would go a long way in trying to get the important messaging that it is a very integral part of preventive health care and has immense benefits which far, far, far outweigh the risks of very, very small which are associated it. Barriers then come at the level of the facility. Though we have a lot of vaccinations in the public health schedule, but some hesitancy of people going to a hospital or going to a healthcare facility. Distance may be an issue if it's a little far, especially in regions with limited access. If it's a hilly terrain or it's a terrain where it is difficult to reach, going to a hospital or reaching a healthcare facility can be a challenge by itself. Then the issue about how a person is treated once they reach there, how the barriers about standing in long queues, standing for a counter, paying some money where you're not expected to pay, and also the question about some stigma about how exactly people will feel around you if you go there for a vaccination, how you will be perceived as. Then comes the level about stockouts. In some cases, you may have some stockouts where you go for a vaccine. There are 10 vaccines which are available. You're the 11th person in the queue. 10 people get it, and the 11th one, it's going to come next week, and that never comes for you. You go back empty-handed. So these are some of the various barriers which we see in our day-to-day practice, especially at a public health level, also at a private health level. I think one barrier which I must mention here is the barrier with the healthcare provider. That is something which is of importance, and that also is one of the reasons why we need to do this among our peers, among our people who are still a little uncertain or a little unsure whether the vaccination is good for themselves, their family members. I think that's where it all starts. Once you vaccinate your girls or your daughters, once you vaccinate your nieces, the people in the family, it then moves forward and you get the confidence that this is something in your best interest. I think that is, so there needs to be still some sensitization among the healthcare providers that vaccination is a great idea and there should not be any doubts that there is something which is no doubts that this is not this is one of the best way of preventive health apart from family planning, which can have immense benefits, as has been already highlighted by other speakers. Thank you.
Dr. Basap, very rightly you have given us an overview of the importance, and I would come to Professor N. Palaniappan on why, what are the gaps according to him, and how can vaccine adoption among women be increased. But before that, I would come to Dr. Ritu Khanna to give us an overview of the Raksha Initiative. What are the objectives? What all is being done?
Yeah. So thanks again to Women's Health. To enhancement of the areas were the lack of knowledge regarding the disease and also regarding the necessary immunization. And the second barrier was the misconceptions. So recognizing the pivotal role of immunization in preventing the range of disease, the Raksha Initiative focused on empowering the women, empowering them with, first of all, the knowledge about the benefits of vaccines, the access, resources, and also to ensure that they receive all the recommended vaccines to the essential preventive measures. So FOGSI and Raksha, they stand as a staunch advocate for preconception vaccination in women, and that's a fundamental step towards building a resilience and thriving society. Now, and the second thing is when they're going to collaborate with a lot of healthcare providers, the policymakers, the community organizations, that's going to be another crucial step to create a comprehensive and sustainable approach to the preconception vaccination. So this is the Raksha Initiative.
Right, Dr. Ritu, thanks for that overview. Coming to Dr. Palaniappan, when we talk about the current gaps in vaccine adoption among women, what are some of the gaps that you see, and what initiative or strategies, can help us improve in vaccine adoption when we talk about behavior change, and how can that be ensured?
Thank you, Dr. Vijay. According to me, the current gaps in vaccination is little touched by the others who spoke about it before. One is the vaccination awareness. Probably the women are not very aware of what vaccines they are supposed to take pre-conception and during pregnancy. And having said that, if you speak of South India and especially Tamil Nadu, let's not go into regions, but anyway, to quote as an example, women here during pregnancy are very fond of taking tetanus toxoid or TD or Tdap. So they are very, very fond of taking that. And so even if you miss an anomaly scan, they would want a TD. They are very particular about the tetanus toxoid vaccine because probably the emphasis is on the tetanus toxoid has been so very much that they are imbibed that thought and they will take it. Even they may not eat an iron tablet or a calcium tablet, but they will take the 2 doses of tetanus toxoid during pregnancy. So that was such the emphasis on that particular vaccine, while the other vaccines are probably in the preconception and in the postpartum period are not very well stressed by the healthcare providers and anybody else. That is one. And two, the other gap which we need to think in terms of is the fear and misconceptions amongst women about the vaccines. For example, to quote, when the COVID was striking, and we don't know still whether the COVID vaccine was useful or not, but when we asked them to take a COVID vaccine, a lot of people had their own resistance to take COVID vaccine during pregnancy. So they had a lot of misconceptions and things like that. So they are fear and misconceptions are another gap. Coming to initiatives or strategies, what we could do is improve the awareness amongst public by probably the pediatric age group who deal with the women till the age of 18, and then probably go on to the gynecologist, after which they would come to us and we would then take off from there and then say preconception and then pregnancy and postpartum, we would take care of their vaccination needs. And improve the media coverage, maybe WhatsApp, Twitter, Facebook, whatever, Instagram, etc., to say that vaccination is so very important for you, and that's absolutely important. So we stress the importance on that media, because anybody who will read or not read, attend a gynecologist or not, but they will go on Facebook, WhatsApp, whatever, and media can be improved. And public awareness amongst women, and maybe camps held by whatever doctors, gynecologists, government, etc. And government probably can stress other vaccination programs programs from apart from TD, probably in the postpartum periods. And I thought recently we had the Union Finance Minister announce that HPV vaccine is going to be announced free for everybody. And so maybe make a mandatory vaccination by the government and organizations like us, and probably also have a mandatory vaccine card, just like how you have an Aadhaar card or a passport, whatever. So you could just make it mandatory and say that, oh, have you taken this vaccine? Have you not taken the vaccine? And then taken off by the ANMs and etc. and people like that. So we should have probably a mandatory vaccination card. This are a little bit of tips and tricks to overcome the gaps and initiate better vaccination for women.
That is indeed very true. Dr. Jaideep, coming to you, how does FOGSI, contribute to women's health advocacy? What are some of the initiatives? How advocacy is done at that level?
Thank you. First of all, let me say that I was very happy to hear from my colleagues from FOGSI, and I think a lot of what they have said already in a way answers your question. And perhaps it's my job here not to add too much to what they have said, but rather summarize what has already been said. FOGSI exists for women's health. That is the long and the short of it. And we work in women's health in essentially two ways. We work in a physician-facing manner, which is the healthcare providers, obstetricians and gynecologists, etc. And we work in a community-facing way. But to tell you the truth, both these are significantly interlinked. After all, how do you differentiate where the community begins and the healthcare provider begins? Because healthcare providers also are part of a community. To give you an example, CME, education for physicians, training for physicians, publications, key practice points which are published for physicians, webinars like the one which we are sitting in right now, ultimately will result in improved knowledge in physicians, which will then be used to treat women in the community. So these things are so interlinked that it's really quite difficult to separate. But since you specifically asked me about advocacy, I'd like to share here that FOGSI has been involved with advocacy at the national level since many years. And some of our notable contributions have been, for example, to the MTP Act. FOGSI was a part of the amendments to the MTP Act in 2001, 2002. We were a significant part in the amendments to the MTP Act, which took place recently. And moreover, FOGSI also contributed to the original MTP Act in 1971. So there's been a long history of FOGSI contributing to abortion laws in India. And think about it. You see, the fact is that there are approximately 14 million abortions in this country every day. And every abortion at some point is impacted by the abortion. And therefore, you could fairly say that by participating in the advocacy for the abortion law, we are directly impacting in one way or another the reproductive health, rights, autonomy, and access for 14 million women. Go beyond that and think about advocacy in a much broader context. And we realize that every woman at some point who goes to a healthcare worker or a gynecologist, who is a member of FOGSI, and we are 43,000 members. So you can imagine the number of touch points that our 43,000 members have, and you see the results of advocacy there. Specifically speaking, again, even when the government was considering the use of the COVID vaccine in pregnancy, I think FOGSI had a fairly significant role to play in that whole endeavor. And also the fact is that service delivery, for example, PMSME, which is the Pradhan Mantri Surakshit Matritva Abhiyan, where the Prime Minister has made an appeal to healthcare workers to provide free antenatal care on the 9th of every month. FOGSI contributes quite significantly to that. In fact, the human resource of the whole program is FOGSI members. And I do not want to overstate it, but I think FOGSI has an extraordinarily important role in women's health in our country. And we hope that this role will be amplified and strengthened through some more initiatives that we have. For example, a 4-state project which we have recently obtained funding for, which is going to talk about quality of care in the intrapartum period. It's going to talk about introducing innovations into tier 2 and tier 3 cities and accelerate the use of these innovations. It's also going to talk about creating a resource hub where all the stakeholders in women's health will be able to come together and share resources. So again, I could really go on and on given the volume of work which FOGSI does. But I think what I have said will probably suffice to give a bit of an understanding of the work we do.
Right, thanks, sir. It is good to know that we are in safe hands. Coming to Dr. Basab Mukherjee, when we talk about healthcare provider and public health agencies working together, when we talk about, because Dr. Tang has already talked about all the advocacy initiatives being taken by FOGSI, then of course Professor Palaniappan talked about how, we can engage on social media, awareness sessions. What, according to you, are some of the ways in which public health, agencies and healthcare providers can come together to address the gaps as far as women's health is concerned?
Thank you, Dr. Bejat. I think public health agencies or people who work in the public health were exposed to the public sector. And sometime down the line in our years of practice, the ground reality or the connect with the grassroots sometimes is not always there. So the public health perspective is something which is at a much more larger level than what one clinician can see, he or she see in a lifetime. So the public health, and it's a bigger canvas which you have, the bigger way of thinking, the engagement with the state and national governments is much more than what would be done at an individual capacity. Yes, it could be done at an organization capacity, but at the same time, they bring a lot of value to the table. One is about the engagement at a much larger level. You come to understand things which make a much bigger difference at a larger level. Like it could be anything from introducing parenteral iron after in a postpartum perspective. It could be something like the use of contraception in the immediate postpartum period, and various things where the benefits are to a larger group of people and the impact is several times higher than what a personal level impact could be. So these are some things which, first of all, it's just about knowing, getting a perspective. The public health people do work with FOGSI members at a grassroots level. So a lot of people who are engaged with or working with are FOGSI members anyway. So they are people who are part of the organization who help them in different ways, maybe the tubal ligation camps, so the tubal ligation things which are done, or the MVAs which are done, manual vacuum aspiration for the termination of pregnancy. That is a lot of that time has been, the man force is from sectors like FOGSI, like a medical organization. So they bring value in the understanding of a larger perspective. They also bring value in doing much larger projects. Like Dr. Jaydeep Tang, the president of FOGSI this year, has a lot of larger projects in mind where you can multiply the benefit which you're doing as an organization to several hundreds and thousands of people around you. So those are important perspectives which they get. They also have a lot of printed publications, manuals, a lot of systems in place which also help you to be systematic and help you to get your organization running and good and just to get. So those are a lot of things which public health agencies bring. Then a logo of a UNICEF or a USAID always attracts more attention. If you want to do a certificate course on contraception, that would be a nice one to always add to and bring value to the table. So these are the things I think which I would like to point out. But I'm sure Dr. Jaideep Tank has more to add on this point because he'll have much more.
We will come to sir. Before that, if I ask Dr. Parikshit about his, since we have come to the end of the show, what would be your major insights for today? How can we translate what all we have discussed into actionable steps to improve women's health outcomes and access to care? What would be your major takeaway?
I think today we are living in an information age. And it's the dissemination of the correct information which is going to drive good health behavior, positive health behavior. So what we need to focus on is the messaging that comes out of large organizations such as ours, aligning it with what is available in the national sector as far as the health provisions are concerned. And that's how we are going to get the synergies going in terms of improving our outcomes. So that's how I'm looking at women's health in particular going forward.
To Dr. Parikshit Tang, coming to Dr. Jaideep, what would be your major takeaway for today's discussion?
No, I think it's already been said. I would not like to belabor the point. However, I would like to reiterate that at the end of the day, authentic, reliable information, which is community facing, which is accessible to the community, is definitely one of the things which Parikshit has pointed out that we are going to focus on, not only now, but hopefully in the future, simply because of the fact that, for example, if you do a Google search for birth, I mean, you can do it now. Anybody who's watching the program, open your browser and do a Google search for delivery or birth. And you will realize that there are over millions of hits that you get. Now, you can imagine that if that is the volume of information that is available, how in the world can patients actually sift through, analyze, come to any kind of a conclusion? And that actually leads to the topmost hit on your search being clicked on, and then relying on that information. Available for that in the US, where there's a certificate given if that source of medical information is authenticated. And I think it is high time that we start doing something like this. Of course, this is not in FOGSI's ambit. This is a regulatory issue which the government or the Ministry of Information Technology will have to take up. But certainly this is something that could be looked at. And of course, the other key takeaway, as you will have already realized hearing this program, is partnerships, synergies across various sectors, most notably the public-private kind of partnerships, partnerships between donor organizations, partnerships between service delivery organizations and healthcare providers, partnerships at all levels. It's unfortunate that partnerships are construed or are considered significant only when they take place at a national level or at the level of the national capital or state capital. I think partnerships at district level, partnerships at block level, at village level are equally important. So I think these are very briefly the takeaways, I think, which one should take from this.
Right, Dr. Jaideep. Partnerships at every level are important. And before we call it a day, I would just want to have one message from all 5 of you on this Women's Day. What would be your, coming to you, Professor Palaniappan, what would you advise women today as it is the International Women's Day?
I would say that women's health is nation's wealth.
Thank you. Ma'am, Dr. Ritu, what would be your advice?
I think the women need to be safe, first of all. So vaccinations for all.
Right. Dr. Basab?
I think, first of all, be proud that you're a woman and just stay safe and be healthy.
Dr. Parikshit?
Women are really the cornerstone of society and they need to look after themselves.
Right. Thank you. And Dr. Jaideep?
You know, my late mom always used to tell me that when I used to sometimes go and wish her Happy Mother's Day, she always used to tell me, don't wish me happy Mother's Day. Every day is Mother's Day.
Mother's Day.
And similarly, on this International Women's Day, I'd like to say that, International Women's Day is symbolic. But in fact, every day is Women's Day.
Right.
And I think it is this attitude which is really important, and we need to prioritize, as has already been said, women's health.
Right. Thank you, sir. Thank you to all the experts for taking out time from their busy schedule and joining us for this awareness session. And I'm sure a lot of women are our audience there. They have taken a lot of relevant information as far as vaccination is concerned. Thanks for being with us.
Thank you.
All the women there, a very happy International Women's Day. Keep yourself healthy, keep yourself safe. And please keep on following our social media pages for more updated information on health and well-being. Thank you, everyone.